Bismillahirrahmanirrahim. Assalamu alaikum. I am Dr. Anwar Shahzad. I will discuss a topic, very important topic today, that is PUO, Pyrexia of unknown origin. It is also called as fever of unknown origin. That is, there is a fever, but it is not being diagnosed. This is the definition being the any fever which is more than or equal to 38.3 degrees centigrade or 101 Fahrenheit, lasting for 3 weeks in an uncompromised patient. So, this is a definition. It means that the patient is running a fever, but it has got atypical picture. Hence, the clinical diagnosis is not easy. So, when this patient comes to you, to us, to a doctor, and he has been running fever for more than 3 weeks and up to a certain degree, then we will classify him, put in a classification, that is a PUO. That is, he is running from a fever which is not being diagnosed and not being treated. So, if we see the causes of this fever, the most common thing or the most common cause is that is the atypical picture of a rare disease. That is, a patient is having, for example, malaria or typhoid, which is a routine fever, but he has got atypical picture. So due to this, the doctor is not sure of the diagnosis. So the patient has been taking this Panadol, paracetamol tablets, and which can alter sequence of the steps of the fever. So other causes could be that the causes could be rare as well. So if we classify the causes or group the causes into 3 or 4 groups. That is, infection. Infection can cause fever, and maybe the common one, that is malaria, typhoid, tuberculosis, and other bacterial infections, abscess, for example. And there could be the autoimmune disease, that is the rheumatoid arthritis and SLE, etc. And there could be malignancy, that is lymphomas, Hodgkin, non-Hodgkin, leukemia, CA cervix, or CA renal cell carcinoma, or any other cancer, malignancy can cause fever, that is the epithelial tumors and also others. And third and fourth is that is the miscellaneous or the others causes, that is drug fever, drug-induced fever, or factitious fever. So this can be is the classification. So when patient comes to you, to the doctor, with this problem, that is fever is not being treated with subsides and it is also not being diagnosed. So we will forward proceed systematically. That is, you will take the history, and the very good history will point us to the diagnosis or the provisional diagnosis and the examination, and that, of course, the lab test and the x-rays and ultrasound and CT scan, MRI, culture, fluid culture, blood culture, or bone marrow culture. So as we see the picture, that is the things which are automatically being clear, that we will keep on proceeding, and we will ultimately, of course, there is a chance that we will reach the diagnosis. And even this is also important, that if the one specialty doctor, the family physician, family doctor, cannot diagnose, then he thinks that the patient should be referred to or consulted another specialty consultant, that is called as multidisciplinary approach. So we can have help of those doctors as colleagues, and we can discuss, of course, with the histopathologist and other experts when required. So this is very important. Again, I stress on the statement that usually there is a atypical picture of a common disease, and if we take more this stress or more think about the history and examination thoroughly, then we can find the cause, or at least we can get the clue or the guidelines to which we will work. So this is very important that the patient which is has the picture of a certain diseases, that is infections, autoimmune diseases, pregnancy. Of course, somehow some picture is again this clear sometimes that the patient is malnourished. It means he or she is having a disease which is more serious or more prolonged. So we will, if we proceed systematically and we read the diagnosis, there are much more chances, and ultimately he will be able to treat that patient. And it is seen that these diseases, the common malaria, typhoid. So tuberculosis is this is a disease which is present around you, here and there. And we, our country is endemic one. So we also should this keep in this our list the possibility of tuberculosis when the patient of the, especially the if the patient has the family history, or the patient has the night this evening fever or the night sweats and having cough. So we can this find this tuberculosis by doing the X-ray test. And of course, there are other types of tuberculosis as well. Tuberculosis of the is the genital urinary tract, bone, muscle, everywhere it can be. So spine. So when the patient has got the family history, then we must search about this tuberculosis by doing CBC and ESR and X-rays and other investigations, even the culture or the PCR, etc. So the endemic areas where the disease, which disease is common, there should be think about more. They think of it that this could be the possibility. So of course, when there are rare diseases, it is difficult to diagnose the rare diseases. Then by multidisciplinary approach, that we will be able to diagnose and we can refer the patient to the other specialty. So this is in medical science. It is again, of course, very necessary to proceed systematically. That is the history examination, and then labs and etc. And then the treatment response. So we should apply this ethical approach to a patient who is suffering from the PUO or FUO, and so that he or she may be relieved from this agony, and which is very much problemsome for him, because it is that this threat to his health, the permanent damage, that is morbidity and maybe the mortality. So thank you very much for listening this video. Please subscribe our channel and like and share and give your remarks. Thank you.